automatically qualified for discounts. Check us out at the Mega Store in Fongolia, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
www.buymothers.com. No standing in line, no wasting your time.
Started feeling mistakes. I had temptations to call it sick, but I end up in Jolly's pharmacy. And down to the street, Jolly's fix some my fix some more. Got me feeling fit and strong. Now I'm ready to work. I'm strong any mission. If you see me, okay. Jolly's pharmacy is number one. Jolly's okay. We cater for everyone. Jolly's okay. Inside the immune system, Jolly's okay. Yo, Dominic, it's about the box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare. Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping for me, nigga. You could be shopping and having fun. If you're not happy, you're so sharp. It's to everyone. What a happy place. Oh, JP Mega. The one-stop shopping for me, nigga. You could be shopping and having fun. It's to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Good morning, and welcome to another episode of Health Vibes. This is Trudy Christian, and we are on with you as we typically are on a Wednesday morning, coming from the studios of Q95 FM to bring you a health talk show with some vibes and some energy. Jacinta, good morning to you.
Good morning to you and to our listening audience and those viewing us live. How are you doing today?
I'm good. It is it's September. School has started. I don't know. I just feel like it's a season of readiness and being prepared, and there's also the independence season coming. So it's just it's just an energetic sort of time for me, at least. I don't know what the listeners feel like in September, but for me, September is an energized month.
Yes, remember it's a new year. For teachers, for students, those who celebrate birthdays as well.
Yes, of
this
course.
month. Happy birthday to you. And like you said, it feels fresh. It feels
like it's a new year, right? Yes.
I want to say a special good morning to all the staff at Jolly's Pharmacy, especially to my crew at Great George Pharmacy. I love you guys very much. We have a great rapport going on. So special good morning to my folks.
Yes. I'd also like to say good morning to Team Jollies. Jacinta, you're doing the big up to Great George Street branch. Everyone. But I want to big up the Mega Jollies, JP Mega. I want to big up that crew. That's my favorite branch, Jacinta.
Yes.
So I want to big up Team Mega this morning. Also, to all our constant listeners to the program, good morning to you. We have people who listen to us from all walks of life, from all nooks and crannies of the island, and also who are listening to us from overseas. So I'd like to just say good morning to our regular listeners. I see on the online feed, the Facebook page of Q95, I see some of our regulars already popping up. Martina, good morning to you. And also, we are live on the YouTube channel of Q95 as well. So, our online listeners, good morning, good morning, good morning. Good morning as well to those listening from the Dominica State College. I have security personnel who always tune in to Health Vibes on a Wednesday morning. So, good morning to you guys as well. I hope that everybody's having a splendid Wednesday and that they're ready to get some health vibes in their system this morning. Just invite September, it's PCOS
Yes.
Awareness Month, and people maybe are wondering what is PCOS. So this morning we're going to help them with that. And PCOS, polycystic ovary syndrome, we're going to be talking about that this morning. But I know there's something coming up later in the month that you have to tell us about for PCOS Awareness Month.
Right. So, as usual, Jolly's Pharmacy always has our cardio jams.
Mhm.
And this month is no exception. It will be held on the 25th and it will be from 5 p.m. So that's opposite Party Shack. So it's close to us where we are speaking from, the big station, and come out ready to sweat. It's always a blast. The music is always on point. So there's never a time you come and say, boy, I didn't feel the workout, So come, be pumped up and ready to sweat. So that's the 25th of September at 5 p.m. So if you leave in work, walk with your workout attire, one time to change, and just be ready to have a good time.
So the 25th,
Yes.
we're doing a whole cardio jam.
Yes.
And Jacinta said you have to be ready to sweat.
Yes,
so
of course.
make sure you keep that in mind and you come ready to work out, ready to sweat.
That's right.
Right. September 25th. Okay, so we have a packed show. This morning we have a guest who is joining us virtually. We have a guest who is in studio. So we have a variety of guests. Of course, we did say it's PCOS Awareness Month, and we're going to be talking about that. But before we get into our topic, let me give you a chance to just tell a friend to tell a friend to tune in to Health Vibes, share the live for those people who are online. And we're going to take a quick break. When we get back, we will introduce our guests and we'll get going. We'll be right back.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your host, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in health.
This morning feeling missing. I had the intentions of calling sick, but I end up in Jolly's Pharmacy. And out in the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work on any mission. If you see me forget, Jolly's Pharmacy is number one. Jolly's forget. We cater for everyone. Jolly's forget. The immune system. Jolly's forget. Yo, Dominic, it's about part of us. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you as we promised this morning's show. We have a very packed agenda, and so we are ready to get on board. For those of you viewing online, you already see who we have as our virtual guest, because you can see the person if you're looking at us online, and you can also see who we have in studio as well. But I'd like to introduce our guests this morning. Joining us virtually, we have Dr. Geoffrey Lafont, who is an obstetrician, gynecologist, and he is going to be joining us, as I said, virtually. We're talking PCOS this morning. And also our other guest who is in studio with us is Rachel Shillingford of Herbal Harmony. So we'll be getting to know about Rachel and what she does. And we're going to be talking to Dr. Lafour about what I'm sure he does in his practice as it relates to PCOS. Dr. Lafour, good morning to you.
Hi, good morning, Trudy. Good morning, your co-host. Good morning to Q95 listeners and all Dominicans and everyone listening in the diaspora. Thanks for having me on in September, special month, my birth month. So thanks for the birthday wishes.
Oh, okay. So Jacinta, as you said, it's birthday month for a lot of people. Uh,
Yes.
so it's a new year for you as well, Dr. Lafour. Birthday month
It,
means it's start of a new year.
it is. Thanks.
Happy birthday in advance if it hasn't.
Yeah, look, yeah, belated. Sorry,
A
Belated.
belated, okay.
All right. Dr. Lafour, you are joining us virtually. Let our listeners know, for those who don't remember who is Dr. Lafour, although they should, but let them know where you're based, and let them know a bit about you.
well, in a couple seconds.
Yes.
I'm Dominican, born and bred, from Newtown. Lived in
Mhm.
Point Michelle as well in my latter stages before going out to study. Um, I was an island scholar many years ago, went to do medicine, and I am based in Barbados as an obstetrician gynecologist, head of the Department of Obstetrics and Gynecology at the main hospital, Queen Elizabeth Hospital, Barbados.
Okay. So
Wow,
you're at
nice.
QEH. Okay. So for those of us, who have been across the Barbados, QEH, Queen Elizabeth Hospital, we
Nice.
maybe are familiar.
Mhm.
Dr. Lafour, you don't have the Bajan twang though. You still have the Dominican twang. How comes?
Because I'm always in Dominica. You might very well see me at Jolly Jam next week for PCOS
Wow.
month. So
So we might see Dr. Lafour at the cardio jam.
Very good.
Dr. Lafour, it is PCOS Awareness Month, as we've said. We use the abbreviation a lot, PCOS, but I want our listeners to understand what is it that we're talking about. So I want you, as the OBGYN in the house, to guide us a bit as to what is this syndrome, PCOS, polycystic ovary syndrome, and who does it affect?
all right, so PCOS is short for polycystic ovarian syndrome, as it is a syndrome as opposed to a disease, because it's a constellation of a number of signs and symptoms that
Mhm.
afflict women in the reproductive age. Okay, so it's not pre menstrual women nor postmenopausal women. It affects women in the reproductive age, so between the ages of anywhere between 15, 16, and 45.
Mhm.
We
Mhm.
tend to want to diagnose it not too early, so hopefully between the ages of 20 and 45. The symptoms may range between lack of periods of menstruation, okay,
Mhm.
of few menstruation, increased hair growth on the body, in abnormal areas like sideburns, the chin, mustache in some women, or the chest, belly, acne, increased, acne formation on the face, weight gain is
Mhm.
another symptom, but they occur in different stages and present differently in different women. Infertility. So some women will very well complain of, I've been having unprotected sex for a while with my partner, I'm not getting pregnant. Okay, so these are a constellation of symptoms that may affect and afflict women with the condition polycystic ovarian syndrome. And the main thing to know is that there's no particularly known cause of it. So that's why it's called a syndrome. So we cannot identify what really caused it, but it is
Mhm.
supposed to be a hormonal, imbalance within the body causing those symptoms.
Mhm.
Doc, the term polycystic, meaning a wide variety or a number of cysts, is it that one would be diagnosed with PCOS based on a larger number of cysts, or can one be diagnosed with PCOS without the presence of multiple cysts being present?
Right. So the answer to that is yes, but and one have to understand what is the presence or the significance of the cyst. The
Mhm.
cysts are located in the ovaries, and they represent the eggs that being stimulated for at least one to come out every month.
Right.
But in polycystic ovarian syndrome, in those women, multiple cysts are stimulated to try to come out, to ovulate, to be ejected, but none comes out. Okay, so the ovaries are stimulated, and then one can see an ultrasound that you have you need at least more than 12 of those cysts present with a particular size, because in most women, if we do an ultrasound, we'll see multiple cysts. But in those women with these symptoms, with more than 12 of those cysts looking to be ejected and none being ejected, then we'll make a diagnosis of polycystic ovarian syndrome.
Okay, so it's various factors that have to be considered. So it's not just one particular occurrence that you base your diagnosis on.
Absolutely. Years ago, there was a criteria called, maybe called, you can Google it, the Rotterdam criteria, where
Mhm.
you have symptoms of no periods or anovulation,
Right.
increased testosterone activity, like increased hair growth, increased acne formation, or male pattern baldness, and as well as the evidence of cysts. And if you had any of the two, and not the next one, you could have been diagnosed with polycystic ovarian syndrome. But invariably,
Mhm.
more than likely, you would see the presence of multiple cysts in the area of the periphery of the ovary, and the ovaries tend to be enlarged at the same time.
Mhm.
Okay.
Doctor, thank you for that, because that question about diagnosis, how is the syndrome diagnosed? How does somebody know that they have PCOS, is a very common one. I think many or multiple women may find out that they have cysts, or they may have some pain, and it is said to them that there's a cyst that's maybe rupturing, and immediately they say, well, I have PCOS. So the definition of the syndrome and what is used to diagnose is definitely important. I want to take you through how you in your practice would make a diagnosis, and I will lead with my story. And I also heard you say that diagnosis, ideally you would want to diagnose somewhere in the 20s or at least before. So I want to lead you with my story. If I was walking into your office as a young woman in my at 18, who had the absence of a menstrual period often, but once in a while, extremely heavy menstrual periods. Um, Overweight, yes, and that's it. No hair, no hirsutism, no hair growth, no other signs, but just the period, the menstrual cycle irregularities. How would you handle that presentation?
Right. So your age is important, and as I said earlier, you don't want to diagnose it at in pre in teen girls too early, because there are other
Okay.
conditions you have to take in consideration. So
Mhm.
you could have um, abnormal uterine bleeding from just because you have immature ovaries, just
Mm.
like you have irregular bleeding towards the end of your reproductive cycle, close to menopause. That could happen in young girls as well. So it could just it could just be developmental.
Okay.
Okay, and one has to wait for the ovaries to fully develop, because some girls very well have late menarche, or that's their first menstruation. So one has to be cognizant of that. One has to be cognizant of other diseases or conditions, hormonal condition like Cushing syndrome. That's an issue with the adrenal gland. So definitely, I wouldn't want to make that diagnosis too early, though the management might be very well be similar.
Mm-hmm.
So if you were to walk into my office with certain, I want to know your age. I
Mm-hmm.
want to know when was your first menstrual period for sure.
Mm-hmm.
I very well want to know whether you have been sexually active or not. The
Mm-hmm.
late period could very well be you're pregnant.
Mm-hmm.
I want to know very well, have you been on any medication?
Mm.
Whether have you been on steroids? Have you been treated for any other condition? One will very well want to know your past medical history with regards to whether you had any head trauma, pelvic trauma,
Mm.
have you had previous surgeries? And then the examination is always important. Looking at your growth factors. Do you have breast buds? Have your breasts developing? Your pubic hairs. So make sure that you have gone through puberty properly. Looking
Mm-hmm.
at your height, your weight, um, your face, hair growth on your body, etc. And the other thing one has to take into consideration, I may have skipped it quickly, family history.
Okay.
Might very well have a family history of delayed menses or puberty or menarche, menstruation in your family. So that may very well be handed down to you as well. And if you're not sexually active, one will have to do a trans-abdominal scan, not a transvaginal scan, if you have never been sexually active. And one will have to look at your ovaries. One will have to look, especially outside. You cannot do a vaginal examination of to see if you have a hymen intact, whether you have an imperforate hymen, because you could very well have an imperforate hymen which causes you not to see a period. And so it's something physical as opposed to hormonal. So everything has to come into play. And where the ultrasound is very important, one has to make sure you have an adequate reproductive tract.
Okay.
Okay, do you have ovaries? Do you have a uterus? Yeah.
Mm-hmm.
Do you have a stenosed vagina? So a lot of things come into play. So PCOS has to be ruled out, has to be ruled in last after you
Okay.
have ruled out every other congenital abnormality and every other possible medical abnormality, especially in a young female.
What I love is the thorough assessment before jumping to conclusions to say whether or not she would be diagnosed with PCOS. I mean, you listed a wide range, and
Mm-hmm.
some of them never really crossed my mind
Me too.
immediately. So that's very admirable, and I really commend this from you that you
Mm-hmm.
take the time going through a list of possibilities and questions from the patient to properly assess before diagnosing. So that's very admirable.
Mhm. This is definitely a learning experience for me,
Yeah.
Dr. Lafo, because I have never been examined in the way that you have described as it relates to there possibly being
Right.
a physical blockage for that menstrual cycle to not be apparent. So you spoke of the hymen,
Right.
and I this is the first I am hearing of this, and I am I hope listeners as well get to learn things from Health Vibes, because as the host we're learning too.
Of course.
So I truly appreciate that. I can tell you though, Doc, as a woman who was diagnosed with PCOS at the age of 26, so it was at 26 that I was officially diagnosed, but I had been experiencing issues throughout my teenage years and, of course, into my early 20s. But what had prevented me from maybe getting a diagnosis earlier was when I read up on PCOS at that time. I don't want to age myself, but at that time, information wasn't as abundant as now. When I read up, the first images that came up were of bearded women. So the hirsutism imagery was high, So it's PCOS means you have this either male pattern baldness going on, or you have hair growth, facial hair growth, and mustache and beard. And when I saw that in my early 20s, because it had been suggested, possibly it's PCOS you're dealing with, a doctor had suggested, and I had refused to go for further test for transvaginal scan. I say, Pam, where? Because I saw the bearded woman imagery. So I want to go a bit into symptomology and how frequently do you see particular things as opposed to other things. So the bearded woman, the hirsutism, as opposed to some of the other symptoms common with PCOS. What's the frequency like?
Well, let's let me backtrack a little bit.
Mhm.
What I'm going to tell you, maybe it will, s- you'll segue into that at some point later on in
Mhm.
your program. I'm seeing more PCOS now than I did when I was a younger fellow. I don't want to date myself as well, but many months ago, I would see maybe one a month. But nowadays, you definitely, if I don't see three a week, I don't see a lot. So we see very much more PCOS nowadays, and we could very well go into the reasons later on in the program.
Mhm.
In terms of how women present, they present differently. So as a gynecologist, people come with irregular periods, irregular heavy periods, no periods at all. Very well but they wouldn't come to see me because of acne or increased hair growth.
Mhm.
Mhm.
Yeah. So women will go to the particular doctor for which their symptom pertains to. So a
Mhm.
dermatologist would see women with increased hair growth and acne, and they have PCOS.
Mhm.
Definitely endocrinologists, because who see women with who see people with hormonal issues, but definitely see women maybe with stunted growth, maybe increased hair growth as well. But gynecologists see women with menstrual problems, women who can't get pregnant,
Mhm.
or not getting pregnant, or women who have persistent pelvic pain, because with the increased little cysts in the ovaries, they very well get nagging persistent pain. So they come with that as well. So coming for increase hair growth might be by the way. So you'll
Mhm.
say, oh, you come with menstrual irregularity, and you say, have you noticed you have beard? They say, oh yes, yes, yes. I've been shaving, or I've been plucking it out, or I've been doing laser. Or you say, do you notice you have mustache? Yes, 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 yes. Or sideburns. So
Mhm.
these are not normal areas of hair growth in women, but they won't necessarily come to gynecologists with that. But you may point it out, and they agree that yes, they have noticed the increase. But the bearded woman is definitely for effect, and definitely you see it in books. You'll see it in books and
Mhm.
different portrayals to highlight, the severity of what could happen with polycystic ovarian syndrome.
Mhm.
Okay, so thank you for this clarification. Um, I wanted to delve a little into the link of insulin resistance and the PCOS. We know that right now, so many individuals suffer from diabetes, but with PCOS, because of increased insulin resistance, the possibility of one getting diabetes, or if they do get pregnant, gestational diabetes would be increased, same as high blood pressure as well, and the list goes on. Could you give us a little explanation on this topic, please, this area?
Yeah, so polycystic ovarian syndrome is linked with diabetes, and the mere fact that it's thought that insulin resistance plays a major role in the development of polycystic ovarian syndrome, in the ovaries not undergoing the changes that are necessary for ovulation. Yeah. Why? Still don't know, but definitely. And so, one possible mode of treatment is utilizing drugs used for diabetes.
Right.
So, the most common one would be metformin. Yeah.
Okay.
And what there's been a very much a high association between women who have polycystic ovarian syndrome with a strong family history of diabetes mellitus.
Okay.
So that's one of the things one has to always ask. If you're thinking PCOS, you have to ask, do you have a family history of diabetes? They say yes, then you know the link is absolutely strong.
So
Um,
in
and
sorry.
and the next thing to that story is the women with polycystic ovarian syndrome have a higher chance of developing type 2 diabetes later on in life. So that's one thing one has to counsel about.
So are we saying that because of PCOS, there is an interruption of on a cellular level where the cells are not able to properly utilize insulin, and that spikes up the blood glucose levels in the body?
Right. So there's an anti-insulin factor. So there's some hormone that's circulating that is not that the woman is producing insulin, but is not allowing the insulin to do its work. Yeah.
Okay. So it's
And
present.
so right. So that's an anti-insulin factor, which is stopping the insulin in the body from doing its work. So the woman is producing insulin, but the insulin cannot function as it should. And that's one of the reasons that the women put on weight. And they will very well tell you, Doc, I only ate vegetables twice a day, or maybe one potato per day. And I tell them all the time, well, if I eat a potato, my insulin will break it down into energy.
Right.
Yeah. If you
Right.
eat a potato, you don't have your insulin does not break it down. Yeah. And it goes into fat storage. So that is where the weight gain comes in with polycystic ovarian syndrome. And however, with the increased weight gain, there's increased storage of a hormone called of estrogens, and that increased storage can exacerbate the PCOS. We talk about the chicken and egg phenomena here now. Which comes first? The weight gain causing PCOS or the PCOS causing weight gain? It happens.
And that is the struggle, I think, that many of us dealing with this syndrome have, that chicken and egg thing. Because of course weight loss does improve symptoms, and weight gain, makes them worse, but weight gain is so easy. So doc, you said, your patients might say they only ate this or that. I will tell my doctor, I only smelt the food. I didn't even eat the food, and I put on weight. That's how easy it is for me. And it's been such a lifelong struggle. And there is this dichotomy of, if you just are able to lose some weight, you see this dramatic improvement, at least for me and many of the people I've spoken to with the syndrome, but it's so difficult to do so. So, what then is the way forward, at least from the physician's perspective, for someone with PCOS struggling to maintain weight, or struggling, and possibly wanting to conceive as well? So, with fertility concerns, what would be the way forward for someone diagnosed with PCOS?
It depends on the age and depends on their want for conception. Depends on their how they present in terms of symptoms. So if it's acne, a young person in their 20s, that's what their main concern. It differs from someone whose main concern is increased hair growth. It differs from someone who just wants to get pregnant. It differs from someone who just has irregular, annoying periods, because with polycystic ovarian syndrome, you could, other than not having periods, you could have irregular periods that sometimes scanty and sometimes very heavy. Okay, so it depends. So, but the hallmark is, I always tell them, diet and exercise. Even if the person not overweight, I always say keep exercising. Yeah, watch what you eat. And I don't want to I'm not sure you introduced your next speaker, who's very much into Herbalife. That there are certain foods, that would help. We very well, if someone wants to get pregnant, metformin the diabetic medication, we may put them on to assist with ovulation. The use of ovulation inducing drugs like letrozole, clomiphene, we utilize as well. If it's someone who just want to just concerned about the acne, then the oral contraceptive pill, there are a number of them we could put them on. Diet, I would say, is essential because we are eating worse and worse nowadays, and the food we eat, especially the meat we eat, impregnated with all sorts of hormones, are not helping. So definitely are increasing the incidence and prevalence of polycystic ovarian syndrome. So we start with diet, start with exercise, watch the food you eat, your choices with regards to food, the ambit of metformin, ovulation-inducing drugs like clomiphene, letrozole, the oral contraceptive pill. These are all in our armory with regards to managing polycystic ovarian syndrome.
Doc, I just wanted to add to what you said. I mean, you listed most of the drugs that are commonly prescribed based on the symptoms. In reference to overweight and dieting, there's also other factors that can play a role in increased weight gain. So, for example, if one is very stressed out or not getting proper sleep, that in itself can increase the cortisol levels, another hormone in our body that would make it a bit difficult to control our weight in general. And so I want to really urge our women, to pay attention to our sleep patterns, ensuring that we manage our stress levels healthily as well. Because imagine, yes, you're eating relatively healthily, you are exercising, but at the same time, other aspects of your life is not under control. So you're fighting a constant battle back and forth. So you have to look at controlling everything in a holistic way.
Definitely.
Absolutely.
Right.
Doc, I have heard, and I just want to maybe as we kind of complete this segment, ask this. I have heard that for women who struggle or have struggled with fertility, with their fertility, women who have PCOS who have struggled, that there is greater possibility of becoming pregnant later on in their reproductive life than women who don't have PCOS. Something to do with egg reserve or something to do with ovulation and as you progress. I want to know what's your take on that? Is that a factual thing? Does fertility supposedly slightly improve? Or is it the same throughout the course of the reproductive life of the woman? I'm talking about without any assistance from medication.
Right. So it's the same for both. But what happens, and because PCOS can come on suddenly, the same way it can be, I don't want to say treated, but go away spontaneously. Okay. So there's some women, maybe in their 30s, the PCOS suddenly is out of the window and they're not aware of that and they get pregnant spontaneously. Okay, so it's not that all of a sudden they get more fertile. Is that the same way PCOS can come in insidiously, it can go away insidiously, all on its own. Yeah. So there are women who will very well give you stories that the doctor told me I can't get pregnant because of PCOS, and look, I have 2-3 children. Absolutely, it does happen. They do ovulate as well, and they do ovulate sometimes. Okay, so that's why it's called a syndrome, not necessarily a disease, where we can have a special identifiable factor causing it. Yeah. So not that you all of a sudden got more fertile, you're all of a sudden, gotten fertile because of the insidious resolution of the PCOS.
Interesting. I really pray for resolution for women with PCOS, because that that is something very amazing. But I have had conversations in the past, or forums in the past, where people avoid or don't feel like any sort of birth control method is necessary because they have
The
PCOS.
difficulty.
They don't necessarily are not necessarily planning to have a child or expecting to get pregnant, but do get pregnant and say, "Boy, I thought
You could.
this was not going to happen because I have
Absolutely.
PCOS." Hmm.
Absolutely. That's very common. Very,
Yeah.
very common. Because you can ovulate anytime, even with PCOS.
Hmm.
Yes.
Okay, so
And
Mhm.
you still
I've seen it hundreds of times.
Hmm.
so in other words, you still advise women suffering from PCOS to exercise caution
Mhm.
if they do not, or if pregnancy is not their primary goal.
Agreed. Yes, absolutely. And especially those who do not want the oral contraceptive pill, but they want metformin to assist them with their weight loss, and they want metformin to assist them with the ovaries functioning properly to ovulate and see a normal period every month. I tell them, use some form of barrier protection if you don't want to get pregnant. Yes.
Okay.
Mhm.
All right. And the final question, I know we have to move on to our next segment.
Mhm.
Many will ask, is PCOS curable? Is there a cure for PCOS?
I don't just say there's a cure. I could say it can be managed.
Okay.
That's what I would say. Because there are many women, if their problems in fertility, you definitely treat them. They do get pregnant, then boom, afterwards, after the pregnancy, the symptoms recur. So to say there's a cure, I'll be lying to say there's a cure. But can you manage? Yes,
Okay. So there's hope to
Mhm.
to at least manage the symptoms.
absolutely.
Management is key.
Yes.
And to the people who possibly, like me, would say, no period is a good thing. I've heard this. I've fought it too, because some people experience difficult periods, and so sometimes when there is the absence of the period, some people say, well, you should be glad, but really and truly, it is indicative of something,
Yeah.
and you should seek medical advice. So I don't want to, that's one thing I don't want to kind of not mention, this thing of, if you're not getting a menstrual period, you're of reproductive age, that it's something that you should not check
Checked
out.
Yeah.
Yeah, well, maybe I should address that as well, because just like PCOS increases your risk of getting diabetes later on in life, as well as heart disease and other cardiovascular events,
Mhm.
people with PCOS are increased risk of endometrial cancer.
Yeah.
And for the same reason you just said, of no periods. So you have the lining of the womb being exposed to estrogens, natural estrogen from your body, with no opposed progestogens from your body. And that increases the likelihood or the chances of developing cancer of the lining of the womb later on in life, which is we call endometrial cancer. But yes.
So much to think about. PCOS has been described as a loaded gun. We've heard all the bullets that it can carry. The higher risk of diabetes, if there's insulin resistance, the cardiovascular risk, the endometrial cancer risk. So we've heard of all those bullets. So management is key. I guess that is a good leg to end on. Dr. Lafo, as we move into our other segment, do you have any closing words for us as we end this particular segment on PCOS this morning?
Well, I want to thank you for having me on Jolly's Pharmacy, you Trudy, and I want to tell you, continue advocating for health in general in Dominica, and in the wider world, because I know people are all over are listening. People have to be cognizant of conditions, things that happen with the body, especially women. And this is PCOS month, so women have to be cognizant of their menstrual cycles, the lack of menstrual cycles, their the increased hair growth, the weight gain, and everything that's happening with them. But my closing take is the diet. Diet, watch what we eat, exercise. I know we are becoming more sedentary. We're driving everywhere in Dominica now, taking bus from Goodwill to Roseau, which is crazy, or from Newtown to Roseau. So we need to put in more steps, yeah, and we need to reduce, the complex carbohydrates we eat. We need to reduce the meat, especially meat from overseas, that are infused with so much hormones and antibiotics, because that is contributing to the increased incidence of polycystic ovarian syndrome. Thanks for having me on again. My pleasure.
Thank you
Thank
so
you for
much,
the
Dr.
info.
Lafor. You have set the stage nicely for the rest of the show, which will continue to focus on PCOS. We thank you so much for your time, and we look forward to seeing you in Dominica soon. The cardio jam, you said, we'll possibly see your face in the place, so we'll look for you.
Yes, we will look for you.
We'll look for you.
Cardio jam next Friday, Jollies.
Right,
Yes.
that's it. Thank
Thank
you so
you.
much, and have a good day.
Thanks.
Yeah.
All
Okay.
right, bye-bye. So let's take a quick break and we will be right back with our new segment, our continuing segment on PCOS with Rachel, who is in studio with us, Herbal Harmony in the house. We'll be right back.
Joy's Pharmacy is bringing vibes to health with Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-host pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
End up in Jolly's Pharmacy. And down in the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work like it's on any mission. If you see me forget, Jolly's Pharmacy is number one. Jolly's forget. We can't have everyone. Jolly's forget. Fix up the immune system. Jolly's forget. Yo, Dominic, it's about part of us. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy. They boost me up real quick. Johnny's Pharmacy, leading the way in healthcare.
And we are back with you. It is Health Vibes. And of course, we're talking this morning about PCOS, polycystic ovary syndrome. Dr. Geoffrey Lafor just gave us a very nice overview about what is PCOS. But right here in Dominica, we have a local advocate for PCOS and the person behind the brand Herbal Harmony. Her name is Rachel. Rachel, good morning to you.
Good morning to you, too, Shirley.
How are you today?
I'm doing fine, thanks.
Okay. So for those of us viewing online, you can see Rachel is in studio with her products laid out. She's in the color. She's wearing the teal colored ribbon. Teal is the color for PCOS awareness. So Rachel is all about advocacy this morning. If you're tuning in online, you can get to see her. Rachel, let us know about you and what it is that you do with Herbal Harmony.
Okay. So good morning to everyone tuned in both here and abroad. My name is Rachel Schillingford and I am the CEO of Herbal Harmony, which is a wellness brand with a focus on female reproductive health, specifically those who suffer from PCOS. I am also a PCOS advocate and an author of Thriving with PCOS.
Nice.
So what brought you to the point of developing products that could help women suffering from PCOS? When did you see the need to specially formulate these types of products? Okay, so what brought me to developing this product is because I myself suffered with PCOS, and I've been to countless doctors looking for answers, and it helped, but it felt like, a temporary band-aid to my solution. So I had to do further research to try to help myself. And that's when I started experimenting with herbs and also dieting properly. And to my surprise, herbs started working for me. So I didn't want to gatekeep, so I brought it out to help my fellow sisters.
So when you say that it helped you, meaning reduce the severity of your symptoms,
Yes.
would you mind telling us what in particular they aided with? So what were you experiencing personally that those products were able to, mitigate the severity?
Okay. Okay, so PCOS, my journey with PCOS, I think it started when I was in high school. I had the irregular and painful periods, and I also had, let's say, the nausea that came with it and everything. But I did not understand what it was. I just felt like it was colic because in our culture, we have to accept that, it's just painful period pain. And I didn't have an answer till I got older. So when I got older, I went in to do a scan, and that's when I was diagnosed with PCOS. I had the multiple cysts on both of my ovaries.
Okay.
So my ovaries were actually covered dark.
Wow.
And I remember coming home crying because you don't know what to do.
Right.
And I began research. And like I said, I started drinking the herbs, but one thing I did different also was my diet.
Right.
So I cut off the chicken, I started eating clean. And for 6 months straight, I went on the herbs.
Right.
And I went back to do a scan with my, it was at Medicos at the time. And before that, I was already there for something drastic that had happened. And that's when I discovered I had the multiple cysts on each of my ovaries. And when I came back, the person who's doing the scan is saying to me that I no longer have it on my right ovary, and I only had semi-bilateral functional cysts, which was free at the time.
Right.
And I'm like, are you saying that's not true? Because I was just here recently 6 months ago,
Right.
and this is what happened. She said, well, take a look at the screen. And that's when I saw there was no cyst on the ovaries. So with that, I didn't want to keep it from anyone. And I said, why not try to help others? So I started distributing to family and friends, and
Right.
they too for relief,
Okay.
either through the cyst or a symptom like irregular cycles. They now got their period. So that's how I know the herbs worked, not only for me, but for other people around me. Yeah.
So, Rachel, how did you know? So, you said you started using the herbs for yourself.
Yes.
How did you know what to use? Is it that you were already into herbal preparations, like you normally used to kind of utilize herbs? How did you know what to put together to first of all use for yourself and then
Yeah.
consequently develop your products?
Okay.
Mm.
So every tea from my line for women, it tells a story.
Okay.
So when I started, I had the hormone problem as well. No periods. Like I would stay without a period for like 2 months, and it comes back on after a while, and it comes with a vengeance. So I started first with red raspberry leaf. I drank it as my water, and I also took Vitex as a supplement. And to my surprise, when I spoke with my OBYN, this is what brought back like a cycle for me as well. And when I did my hormonal panels, I'm now seeing that I have labs that are intact. And like, okay. So she said, continue doing what you're doing. She did not, oppose to my natural side. And then I had, for the periods, now the painful periods, I started experimenting with, it didn't start like that. There was something I had to go to Kempinski, and I wanted to go, and it was COVID time, and the flu is around. So I started drinking lots of ginger and turmeric, oregano. Like I just put a pot together. And then I noticed I got a period, but with no cramps. I'm like, okay. So I started drinking that tea now every time the
You had your
cycle was
period.
coming.
Okay.
So I started doing more research, doing short courses on herbal teas, and I started finding out, like, for in case the PCOS, the different herbs that I could put together to target everything that does with a particular symptom. For example, cinnamon in there would help with the insulin sensitivity.
Right.
The Vitex would help with decreasing like regular
Yeah,
estrogen and
progesterone level to help with ovulation, so that in return will give me a balanced cycle. And then I put in the nettle, which will deal with the fatigue and the iron levels to give me more iron, and my dandelion, which helps with detoxifying, and also the mint in there to give me calm so that I can sleep at night. So that's how I formulate it all together.
Nice. Okay, so you're right. So you experimented, you felt relief yourself when you put together certain things, and then you did the research and came up with a complete product. Yes.
What I love about her line of products, she is specific with your dosing.
Yes.
And this is something that we always are concerned about when mixing herbs together. How many leaves do I use? How long do I let it set for?
Right.
How many times a day? How frequently? So your directions are very specific. And easy to follow. And I think you also have some precautionary notes there as well to follow. So it gives one comfort that you're not just taking some leaves from a package, and putting it in a cup and drinking. Yours is very specific and tailored to the symptoms, as you said. So I give you kudos for that.
And it's also very eco-friendly. I mean, the tea bags, it's not like, the types we acquire, some of these cotton tea bags. So I went towards the health side, and as you can see, one of the instructions on there, one tea bag can give you 3 cups or 2 cups of teas, which is true. So it's affordable and also healthy.
Okay, very nice.
Yeah, so Rachel, with you have the 3 teas: PMS relief, PCOS support blend, and the red raspberry leaf tea. You can show our online viewers your packaging, which is, pretty attractive, I must say. And available at Jolly's Pharmacy. So you can get her tea preparations, Herbal Harmony, at Jolly's Pharmacy. And how many tea bags are in a packet?
There are 10 tea bags per packet.
10 tea bags per packet, and you're saying one tea bag can give you two to three cups of tea. So you can easily have 30 cups of tea from one bag of tea. Rachel, what is your best selling option out of these 3? The PCOS support blend, the PMS relief, and the red raspberry leaf tea. Which one does the best with consumers?
So my best selling teas are both the red raspberry leaf tea and PCOS.
Okay, so those two go off the shelves quickly. Okay.
Because the red raspberry, it helps with uterine health. It's also dubbed the women's herb. So, it's always going to sell. It's a well-loved tea around women.
Okay.
Some have sworn to it, helping them with conceiving. Also, when they pair it with the PCOS blend. Now, for PCOS, it's also a bestseller because I advocate heavily for PCOS, and the women who follow me as well, they drink that tea.
Right.
Okay. So, with individuals who may not be diagnosed with PCOS, but experience symptoms similar to those suffering with PCOS, so the heavy bleeding, the mood swings, the fatigue. Would the PCOS package be appropriate, or the
PMS relief?
Yes, so the PCOS package would still be appropriate because every herb in there is also for female reproductive health.
So you could still use it.
Yeah. However, I shouldn't say however, but would you advise a woman who has come across your line to still seek medical intervention if they're probably trying to conceive, and just stick with your product line? What did you advise?
I do advise consulting with your medical doctor first, because doing a proper lab testing will help you. Doing testing to find out what hormonal levels are not regular, and also there are 4 types of PCOS, so what might work for someone might not work for you. So knowing where you fall can actually help you.
It's very important. And of course, as doctor went through the different symptoms and complications of PCOS,
and depending on what other medications need to be prescribed based on what you're going through, they would also give you advice as to how the herbal products can tie in
interfere.
Right.
with them, if they can if they will interfere, or if it is very safe to use in conjunction.
Yeah,
Mhm,
that's
true.
mhm. Yes, the pharmacist, the pharmacist in the house would bring that up, and that is such
I
an
know.
important thing.
Yes.
And we talk about it for all other health conditions as well, and PCOS no different. So if you are, using a herbal treatment or remedy, you need to also have that information with your health provider, medical provider, pharmacist, so that if there's any other thing that you're taking, you know clearly what cannot interact, what you should not be using simultaneously. How do so that is very important. The information sharing between alternative and, your conventional medicine. Very, very important. I want to open up the lines. So I do see we have quite a few listeners commenting on Q95 FM's Facebook page and YouTube channel, listening to the program. But I want to give our radio listeners a chance to call in. The numbers, of course, 449-3095, 449-3096, 449-3097, and 616-4257. If you're trying to reach us from overseas, I do know we have overseas listeners. The number is 305-432-9624. So, Rachel, it's September. It's
Yes.
PCOS Awareness Month. And as a PCOS advocate, I know you are in overdrive. Let us
yes.
know what activities you have been spearheading, you've been doing, and what's left for the month of September from you and Herbal Harmony.
Okay, so because on my platform and the many women I get to speak to, I use my platform to also advocate. And every September for the entire month, I put on different activities that can help raise awareness. So when I started with a sip, tea, and chat at NDFD, which went very well.
Okay.
We had one-on-one consultation. The endocrinologist, Dr. Maxine, was in the house where she did free consultations and also gave the necessary testing that they could go and get done. So it was a moment of sisterhood and also just, sharing and getting to know more about PCOS. And besides that, I will be also doing the cardio jam with Jollies. I have partnered with Jollies. The Jollies came on board last year, and ever since they have continued. It is said they're leading the way in healthcare. They have proven that. And then I have the school visit, which is coming up. I also try my best to go to the schools to raise awareness to the younger girls, because I wish I had someone hold my hand like I am doing it now. So early awareness is also very important. So I will be doing that. And we also have a cooking meal for PCOS where a few of us will be coming together. And I also partnered with Adams Healthcare, where we went live and talked about the necessary testing and tools, especially to the hirsutism that they have offering. And I will also be going there shortly to do a free complimentary facial.
Okay.
Yes. So
Okay.
I also have something. I'm not going to keep it a secret, but there will be a further launch of something that's coming up, so they can stay tuned to my Facebook page. And I will be ending it with a dinner at Time on Time Restaurant, a sisters dinner.
Okay.
And we will be coming together, a few women with PCOS, where we go to Time on Time to have a PCOS friendly meal together. Last year we did it. We had karaoke and it was so fun. And I will also be continuing by saying thank you to everyone. That's how I'll be ending my PCOS month. But it's going good so far.
Very packed.
Yes.
Jam packed.
Yeah.
You had this sip and tea, and then you're going to be doing the sisters dinner. So so it's nice time for people with PCOS to get together, and the other awareness activities that you have organized sound all really good. So I do hope that everything runs successfully. Rachel, I know you have a book as well.
Oh yes.
Yes, tell us
Mhm.
about it.
Okay, so besides having the products, I wanted to launch a guide that could help women also to just read and know about my journey. In that guide, it's called Thriving with PCOS, a gateway to win the battle against PCOS. It's a book that empowers women with PCOS, my journey, the symptoms of PCOS, what is PCOS from a medical standpoint, and also natural remedies and meal plans you can follow to help you thrive.
And
Oh.
that's very nice. Where can one purchase it?
They can purchase it from me or on Amazon at present.
Okay, so it's on Amazon.
It's on Amazon.
So the name is Thriving with PCOS, a gateway to win the battle against PCOS.
Yes.
PCOS. So this is what you type on Amazon, or at the back of her products are her contact information. So telephone number 225 3872. I'll say it again, 225 3872. And she also has an email address, which is herbalharmony767 at gmail.com. So if you want to reach out to her, whether it's concerning her book or her products, you can do so.
Yes. And I also have a sisters group chat. So it goes beyond just coming on my platform. I put together a group where it's a safe space for women to share their stories. It is confidential, of course, and we get to share meal plans and, daily motivations, because, besides the symptoms of PCOS, there's also depression and the mental aspect of PCOS. So I just wanted to lend my hand further. So if women are looking forward to joining that group, it's again my number, 767-225-3872.
I'm happy you have this platform. I think we have a call. Okay.
Yes, we have a call. So let's take this call, and then Jacinta, we will not forget you are going to say something. Caller, good morning.
Morning, ladies. How you all doing?
Hi,
Thank you.
Hi, good morning.
I'm calling to compliment you all on such an important program.
Thank you.
I passed that stage already, but a lot of the people that may be in their 30s, their 40s, teens, interested in listening to that topic this month. So very, very good. How you call that? Educational piece. Thank you for sharing that with the people. And Dr. Lafon, yeah, thank you. And the last doctor you had last week, what was
McIntyre.
And Dr. Lafon, sons of the soil, especially Dr. Lafon. And I seen him little boy around Bathroad. Bye bye.
Thank you.
Thank you so much.
Yes, I remember Blue calling. We've done PCOS before on the show, like maybe last year during September as well. And I remember her calling and mentioning that she had seen somebody with facial hair, and now she's understanding or acknowledging that maybe it's PCOS. So these sort of shows or these sort of conversations that we have can also broaden awareness for people not suffering with the syndrome, but who are now able to recognize that there are things that people go through that are actually a health issue. And what can happen is that, well, my fervent hope anytime I do an awareness sort of talk is that people become more empathetic to the struggle of others when they understand, what is actually going on with that person's body, and how a lot of it is not under their direct control. So sometimes we can be so judgmental,
Insensitive.
yes, and insensitive, and we can say, boy, look at that, this and that, and the person's weight. We might comment on the person's the prevalence of acne. We might comment on the
bald.
Yes,
penis,
bald.
yeah.
Yes, the person losing their hair.
Yeah.
We might comment on as I said, the beard.
Yes.
We might comment on so many things, or the absence of children. We might
Yes,
comment on that
that's
as well.
Yeah.
So long she cannot make a child, then so
I know.
those kind of things. So these sort of awareness, your campaign, Rachel, and us doing this conversation here on Health Vibes will definitely help people to become more
Right.
aware and empathetic. Yes.
Because on Facebook, some time ago, I noticed there was some picture circulating, and it was of a woman with beard, very beautiful woman, and I noticed that
a man shared it, but to my surprise, women were under it laughing. Oh, that's a man, And I took that post and I reshared it and I said, you don't even know that's an underlying condition. It's hirsutism. And someone might just be going through it and it's like body shaming. So you have to help bring the awareness so that, they can be more aware because some people are ignorant to the cause. Yeah.
Very true.
We have another caller. Let's take this call. Caller, good morning.
Thank you, young lady, for sharing that gesture there. Last week or week before that, I was looking at that youngster, beautiful lady, and she has so much facial hair. She said she's fed up of cutting from her sideburns going. She married now, and she have her husband, and people that look at her, she says she stopped shaving. She's beautiful, and she's looking at herself as a beautiful woman with beard. Today I have beard. You might not see it, but I have beard. And I came by a young girl. I wouldn't want to say whose family she was. But right now she's in the States. And she had a lovely beard. But under her chin, she didn't have a child. And she was maybe in her teens also. And she was very beardy there. Yes, so that happening. And sometimes we don't know what caused it.
Right.
We've seen overweight people. Somebody, why she will say, oh, she take by her family. Sometimes it could be some medical problem that causing that. So we must stop. As another person, Meg. But they will say, okay, Meg, why you so Meg? They don't know certain person just trying to stay, on a certain level, but they will find something to say. Thank you, my lady, for sharing that. Bye-bye.
Thank you. Yes. So that is evidence of exactly what we're saying. Jacinta, I know you were saying something. Do you remember what it is you're saying?
Yes. I was just commenting, Rachel, on that platform that allows women to share their stories.
Thank you.
And you mentioned a very important fact that it can affect one mentally and emotionally because, as women, we go through so many changes physically, and this is of no exception. And the mere fact that this syndrome can affect your day-to-day life, so your wants in life, it can play a role in or affect us emotionally. And having that support, women to women, and also men out there, being more aware and more sensitive to what we are going through allows us to connect even deeper with them and vice versa. So I love that platform.
As you mentioned, men, one of the most frequent thing that women with PCOS go through, they actually have a low libido. So having a right partner that understands comes from PCOS, it helps.
Of course, and for those who don't know what libido is, that's a sex drive. So with PCOS, your sex drive may be reduced. And as you rightfully said, having the right partner who understands and is willing to be with you regardless is important.
Yes, that's true.
And Rachel, you outlined some of the things that you're doing. You also mentioned the WhatsApp group and it being like a source of strength for women to be able to share their stories and so on. Do you get a lot of women joining that group really wanting that sort of comfort from the others, or are people reluctant? What is your experience with the WhatsApp group so far?
Well, I have gotten a lot of women joining the group because they want help.
Okay.
Because before I created the group, my line was like, I would get a call in the middle of the day while I'm doing packaging, and I have to drop what I'm doing just to take that call. Because someone might be depressed, especially where infertility is in question. I have many women who go through that and they just want somebody to talk to just tell them it's going to be okay. Some women, they're trying so hard to maybe bring on a period and they just want my advice on something. So yes, I have gotten a lot of good feedback, especially now. So the group chat is like somewhere between 150 something women going. So it's good. And I wake up every morning, the first thing after praying is sharing a little motivational tip to get them going, or at least a meal plan.
Wow.
Yes.
Okay, so that's very commendable, and I hope that people are finding, true support with your endeavor, because it's a very commendable one. Definitely.
Keep up the good work.
I will.
Because more and more women may be diagnosed with this condition, and knowing that there is treatment, whether it is with your products or with what other options we shared earlier on,
Mhm.
and even with your book, your different
Sure.
platforms,
Mhm.
keep it up because we need that support. We need that
Yes,
support.
and
Mhm.
some women are silently battling that
Right.
because
Mhm.
of the fear of being judged.
Mhm.
So, you just want to stand up and be a voice to the women who are living in fear. So,
Mhm. Mhm.
it took me courage to come out, but I did not let it win.
And see the good that it's done.
Yes, yes, definitely. So we're approaching the end of our time. We have had a very full discussion. I mean, just to recap, we had Dr. Lafo on, and he did speak to what is PCOS, polycystic ovary syndrome, and the complexity of it, and also the impact that some lifestyle choices have on its management. So he really reinforced the need for exercise, for proper diet, which is sort of avoiding all the processed carbohydrates and meats that may have hormones and antibiotics in there, and focusing on a more healthy diet, fruits, vegetables, natural sort of food. And we have Rachel coming in and giving us the outline of her teas and what is in there to offer relief for some of the symptoms of PCOS. So we've had a full cascade of everything. And I hope that people, at least because I do see quite a few people tuned in. One person said, I suffer from PCOS and it's not easy at all. Rachel, you have people shouting you out here on the live. So I do hope that people listening kind of, got an idea of what PCOS is if they did not know, and how it is best managed, and that they can follow some of the other activities during this month. Anything you want to specifically invite the general public to, Rachel, for the rest of the month? Mhm.
I would like to invite them to Jolly's Cardio Jam.
Right.
Come on out and sweat. As the doctor said, exercise is a very big part. So you can start, if you haven't started, start with Jolly's Cardio Jam. And also, if you want to take part in the Sisters Dinner, I welcome you on board. We will be going. It's on the 28th of this month at Time on Time in Scottsdale. Yes, and the River Lime, it's open to everyone. You can just send me a message on my WhatsApp, which is 2253872. And stay tuned to my Facebook page where I would send out daily information on what will be posted next. I also share little details on PCOS and even on TikTok as well. So I try my best. Yes. And if you're interested in the teas, it's of course, it's available at Jolly's Pharmacy. It's available at We Church, AC Shillingfords, Zeb Creole. And also, if you're in St. Martin, it's available at Caribbean Favorite Health Store and at Sister Nut Essentials in Antigua. Yes.
So you're regional as well.
Yes, I'm international.
Yes. So
Yes.
St. Martin and Antigua can also, and Rachel, one thing, you mentioned the book that you have is available on Amazon. And from you personally,
Yes.
I know that Jollies.dm does highlight some local offers. So my suggestion is to get that book
on Jollies.
on
yes.
Jollies.dm.
They have highlighted mine. I'm also the author of Thriving with the Timato that could, because I wear many hats. So I'm also that. So it's on Jollies DM as well.
It's on Jollies.
Yes.
Okay, all right, nice.
Yeah.
We need everything at Jollies.
Amen. Yes, that's true.
yes, definitely. So Rachel, thank you so much for joining us
You're
on
most
the
welcome.
program and for highlighting everything you've done. I know people have gotten some sort of hope and some sort of, feeling of at least there is support available for them. People who have been listening and maybe have PCOS themselves. So thank you for that.
I just this month, just into PCOS month, I had 2 wonderful testimonies. 2 women fell pregnant by using the products that they saw by and following my advice. So
right. Congratulations to them.
Yes.
So just invite, it is the end of another show, another Wednesday. You've been two weeks in a row now on the program. Next week, Leona should be coming on. We will see. But we're signing out now here from Health Vibes, and we just like to wish our listeners a great rest of the week, focusing on health and wellness and everything good. Hopefully, we'll be back with you if God's will next week, Wednesday, for another episode of Health Vibes. Take care and see you.
Bye-bye.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes each and every Wednesday.